Hi everyone, happy Thursday. This is Diane Manuel at Urban Wealth Management. I want to welcome everyone to our Smart Women Savvy Money 2010 webinar. 20 minutes on the clock, 10 minutes of questions, and we're here today to talk about Medicare. But first of all, I know, overwhelming. First of all, I just want to introduce myself. I'm a financial advisor here at Urban Wealth Management. And for those of you who know us and have been around, welcome back. And for those of us that are new, I'd like to welcome you to our firm. As you can see on our page, Urban Wealth Management is a full-service financial services firm. Our goal is to help you get your financial life in gear. And we do that by helping our clients organize, prioritize, strategize, and thrive. Part of how we do this is also by hosting a number of different events, just like this webinar. We hold monthly webinars the second Thursday of every month, except December when we're dark. But otherwise, we're pretty busy with a variety of financial and lifestyle opportunities for you to learn something different and to help expand your life. We have a number of different activities and events coming up. And I want to go through them really quickly with you. First of all, this Saturday, the Mount St. Mary's Women's Leadership Conference, Renee Norris is my colleague, and she'll be facilitating a panel there. Renee is also going to be on Closing Bell on September 26th. I will be speaking at Sage Sisters in LA and the California Black Women's Health Project. It's a day-long event of really talking expansively about women's health. Next month, on October 11th, our webinar is going to be talking about your digital assets from an estate planning standpoint. So I really hope you will join us then next month. On October 13th in San Francisco, I'm hosting and Urban Wealth Management will be hosting Ignite Your Power. It's a day-long conference for women living boldly. So we'll talk about finances. We will talk about, we'll set a mindfulness tone for the day. We'll talk about philanthropy. We're just going to cover a variety of different things that we know are important for women. Most importantly, the early bird registration in September 15th. So go to our website, click through this, and you'll see the promo code of early20, and you'll get $20 off. So that's good until Saturday. And then our last two events, our webinar in November will be with Dr. Lois Frankel. And she's starting to write a new book. She's a New York Times bestseller. And we are always happy to have her toward the end of the year, and she brings new ideas and helps us get ready from a leadership standpoint for next year. And she is also a philanthropist. She founded Bloom Again, which is an organization that really helps women who have health needs and they are in financial distress. So they really get the money out there to help women pay their rents, utility bills. They're a quick response organization. So their 10th anniversary is coming up in October. I will be there, and I'm more than happy to have all of you all join me. So without further ado, I want to introduce you to Debbie Hoffman. Debbie is a rock star. She founded Hoffman Insurance Services. So Urban Wealth Management, the way we work is very holistically and from a 360-degree perspective. And that means we have to have some of the best experts all around us because there's a lot of brain power here, but we don't have it all. So Debbie and her team are really our go-to people for health insurance. They specialize in Medicare, which is a maze. We actually got a question on our Facebook page today, like, help, I can't make the webinar, but that's okay. We'll get the information to this person. So I want to introduce Debbie to you, and she's going to walk us through some real high-level issues and ideas related to Medicare. So Debbie, hold on just a second. I'm going to share the screen with you.
Okay.
And you should get a little pop-up that says that you can take over.
All right, start sharing. I'm pressing the button and it's not wanting to go. Oh, select all. How's that?
There you go. And if you could just speak up or hold your speaker to your mouth a little bit more.
Is that better?
Yes.
Oh, great. Thank you. And thank you so much, Diane and Renee and all your advisors at Urban Wealth Management for putting these on. I think it's amazing, and we've gotten a lot of feedback just from advertising it. So very, very happy to be here. And, oops, did I just press the button?
Yeah, you just need to work with your screen a little bit.
Okay. Can you see the screen now?
Yes. And I think you can click the minimize button, the green bar at the top, the minimize, just minimize it, yeah. And you can probably move me out of the way with that little arrow key. Do you see that?
I should have minimized it. It's minimized on my screen.
Yeah, do you see me, a picture of me, if you can minimize?
No.
Move.
Minimize.
Yeah, there you go. You're good to go. Perfect.
Okay, awesome. Well, we're going to get our track shoes on today because literally I could speak an hour and a half on this subject, as you can imagine. So we're going to give you pretty much what we consider the 30,000-foot view because, you know, if you've ever had anybody that went on to Medicare or maybe helping a family member with it, you know good and well that there are a lot of things to discuss when you're looking at Medicare, you know, when to enroll. But our job, we feel, is to work hand in hand with your financial advisors, which I love working with Urban Wealth because they're so proactive. They're looking for these things that you'll see could be a really big problem down the road if you don't address it early enough. And so we're about putting you in a better health and wealth position. We'll talk briefly about some 2019 changes. Just kind of, this is seriously the tip of the iceberg. And so when we speak with clients, we can fill in the hole. It's no wonder everybody is so confused. I mean, if you look behind me, there is a stack of just a portion of what somebody receives when they're turning 65 or during open enrollment when we're getting ready to go into that right now. And I'm sure the mail is piling up for people. And, you know, who do you trust? Who do you know? What do you do? If you're turning 65 and you're still working, what should you do with your Part A and B? You know, what role does the ACA, the Affordable Care Act, play with Medicare? What happens if your spouse is working? There's so many different questions, and this is what we see. Literally, I have gotten phone calls 2 days before the end of when somebody was supposed to enroll, and they just don't want to address it. So we literally make things easy for our clients and take a lot of the load off of them. So here's just a few things of why everybody can be so confused. You know, later on, all these enrollment periods and, you know, then what am I supposed to do with my medications? I'm on some heavy-duty medications. You know, who knows? We know. And so you want to work with somebody that has been in the business a while, that has your best interest at heart, somebody that can help you sleep well at night. That's our goal, too. So, and literally, I think a lot of people have heard me do this, but we love staples, and we love when our clients can press that button. So this is what we're going to do today. So when you think about Medicare, I want you to think about 4 and 3. There are 4 parts to Medicare and 3 options. In simplistic terms, that's pretty easy, right? So the 4 parts of Medicare, again, get your track shoes on. Part A is your hospitalization. Now, we like visuals, and it's hard to remember a lot of these things. So one of our little sayings to remember what A does is when you have an emergency, you have to go to a hospital, right? B is for your doctors and outpatients. Mommy and Daddy always wanted me to be a doctor. B is for doctors. Part C we're going to talk about in a little bit. That's Medicare Advantage. And then Part D, they made this easy for us. C for drugs. So let's just break it down a little bit. Part A, again, hospitals and some of your hospice care. Part B, by the way, let me back up a little bit. Part A, if you've paid into Medicare, which means you've worked 40 quarters or 10 years, you pay no premium for Part A. Now, let's say somebody came in from out of the country and they're here legally. They can, and they haven't paid into it, they can actually pay for Part A. I think it's around $440-ish per month. But for everybody that's worked, you've already paid into it on your payroll tax. Part B, that's for your doctors and outpatients. Now that's, MRIs, labs, things like that. There is a premium attached to Part B, and we're going to talk about things to avoid here soon. But right now, in 2018, the Part B premium is $134 if your income is below certain limits. Think of Medicare A and B as an 80-20 plan. Like when we used to work, we had, the insurance company paid 80% and we paid 20%. That's very similar to Medicare. It's really a really good plan. And it has 2 deductibles, the A deductible and the B deductible. Now, when can you get into Medicare? Well, there's an initial enrollment period when you turn 65, and that's a 7-month window. I would caution people against enrolling in the last 3 months because Medicare has this amazing little chart that says if you enroll on your month or after, your Part B won't start for several months. So anybody have any questions about that, reach out to us and we'll get you that chart. But it becomes a little bit muddy. So if you can, you want to enroll beforehand. Now you can enroll in Part A any time of the year. There are no restrictions because if you paid into the 40 quarters, it's no charge. But B, there are enrollment periods. Now there's an annual enrollment period for your plan. That's coming up. That's not a Part B. Don't confuse it with Part B. That's for your plan. That's when you can change your Part C and D, which we're going to cover. Then there's special enrollment periods. That's when you move or you leave an employer group. Maybe you're 68, you worked a little bit longer, you love your employer. Then you have a special enrollment period. You're going to want to reach out to us 2 months before your insurance ends. We'll walk you through how to get your Part B in place. And then what happens if you work past 65? That's each situation's different. We need to review it because it really depends on whether you had creditable coverage when you worked. And also there's another part of that rule a lot of people don't know about. You have to have credible coverage and you have to have worked or your spouse have worked. If you, for instance, went on workers' comp before 65 and your company is paying your insurance for a couple of years and you're now 68 and you didn't work for those 2 years, you could have a penalty. So again, we want to avoid these gotchas is what we call them. The first gotcha with Part B, if you make more, you pay more. Now, guess what? And I love Urban Wealth Management because they look at this with us. When you turn 63, if you're going to elect your Part B at 65, when you're 63 is when they're going to look at this income. So in this case, you're turning 65 this year, they're going to look back at 2016 taxes, and there's something called an MAGI. Your tax person can help you with that. And if you look on the chart, you can see where you might be. So instead of the $134, we have clients paying upwards of $428 a month for just their Part B. Now, why that happens? Sometimes we have people that maybe their financial advisor or their CPA says, you really ought to convert that IRA to a Roth. this year before you retire. Or let's sell some of that rental property over here and they have a capital gain. So guys, work with your financial planner really closely on that. See if we can minimize what you have to pay for. And by the way, this can be reconsidered. We also have the form to help you get reconsidered. Here's that penalty we talked about. This is if you're late enrolling into Part B, you're going to have a 10% penalty of whatever the Part B premium is that year. In this case, if you waited 3 years, you'd have an extra $40 to pay on your Part B premium forever. And there's a little bit of an asterisk on the forever, because if you are under 65, you get a get-out-of-jail-free card, and that penalty goes away when you turn 65. But again, everybody's different. We can discuss all these yourself. Now, what does Medicare cover? And normally, it's easier to say what they don't cover, because it really is a comprehensive plan. So what does it not cover? It doesn't cover long-term care. There's a difference between skilled nursing and custodial care when you need help with the activities of daily living. So that's totally different. Long-term care is not covered under Medicare. Dental, routine dental, dentures, cosmetic surgery. Oh, but you know what? There is one procedure that Medicare is covering, and they're doing an awful lot of them nowadays. Diane, I don't know if you're still on. Do you have any idea what that might be?
Yeah, eyelifts, because I just got one because I couldn't see. Wasn't Medicare, but the insurance did pay for it.
Oh my gosh, that's exactly it. As we age, our eyelids tend to
droopy eyelid.
Yeah, it covers our vision. So that's medically necessary. And they actually do cover some dental work if it's medically necessary, and there are a bunch of medications that cause your teeth to fall out, which is amazing to me. So, but Medicare will cover then. And, you know, hearing and vision, ophthalmology is covered. That's your medical doctor, but not optometry or your glasses. So that's where we work holistically with every part of your insurance, and we can help guide you. Acupuncture, unfortunately, is not covered, but chiropractor is if you have a problem. Now, here is the Part C, the third part. We're going to talk a little bit more about that later, but they're called Medicare Advantage plans. Now, this is new for 2019. We're very, very excited, but the government gave Medicare Advantage plans the ability to add home health care as an option this next year in 2019. So that's exciting. I'm hoping some of the plans pick it up. And we would always get a call, usually about the middle of January, with a client or a prospect that found us, and they said, oh my gosh, somebody put me in this plan, and I went to get my meds, and they're costing $200 more than what they used to. What can I do? And we didn't really have much of an option for them. Now we do. There's going to be a change period from January 1st to March 31st that you can change one time. Again, work with somebody that knows all your medications and your doctors to make sure you're in the right plan if you want a Part C. And then the fourth part. So we know A, B, C. Now we have to D, and D's for drugs. They made it easy. Again, all of these plans, there's about 30 in each state or more. They range in different prices, and they have different formularies, and some pay more in the donut hole, which we're going to briefly discuss. So you want to work with somebody, and by the way, this changes every year, every single year, and that's why open enrollment coming up. That's when we're very, very busy. We're looking at all these changes for you. So how'd they take something so good and make it so bad? So we're not going to, this could be a whole nother webinar, Dan, but the donut hole in Part D is where, instead of you paying co-pays, when you get to a certain amount, you have to pay a percentage of the medication. And if you're on an expensive medication, that can be very costly. This year, it's when your total cost equals $37.50. Now, that's not just your copay. That's what the insurance company is paying also. So this is a really important feature. You want to know when that's going to hit, if it's going to hit. Another gotcha. This is Part D gotcha you want to avoid. Remember that higher income for Part B? Guess what? You get it for Part D too, as long as you can until it gets reconsidered and your income goes down. So again, it's really, really important that when you're younger, you might want to work with Diane and Renee and her staff and her team about maybe converting some of those IRAs to Roth IRAs early. Roth IRAs don't appear on your MAGI. Ha-ha. We love that. And again, if you don't get into Part B when you're supposed to, guess what? Another penalty. So again, we want to try to avoid these. That's why you want to call us ASAP. Now, on those 4 parts, notice there was an S, A, B, C, D, S, so the plural. That stands for supplements or Medigap. Just think about this as a foreign language because it has a bunch of different plans, A through N. However, don't be confused with the A, B, C, D of Medicare. It's totally different. These are mandated all to be the same. We're going to put it all together in a minute, so just keep following us here. There's different initial, open, and special enrollment periods for Medigap, so you can understand why it gets so confusing. They are, even though they're mandated to be the same, in other words, a Plan F needs to be just like Plan F with one company as it is all the other companies. There's 2 things that can be different. How they calculate your premium, and if they offer you extra benefits like a gym membership or vision or hearing that Medicare doesn't cover. California, by the way, and Oregon gave us a wonderful gift, and I would hope that the rest of the country is going to follow suit. It allows us to switch Medigap plans, the same or lower, 30 days following our birthday. It's called our California or Oregon birthday rule. So you don't have to prove insurability when you're in that, if you're in those states. If you're not, it's tough because you have to prove insurability. Now, the problem a lot of people have, especially if they're in other parts of the country, is what happens if I'm insurable? I want to be able to get a Medigap plan. Well, if your Medicare Advantage has increased by 15% on any benefit, and one year I had a lady with MS, and she wanted to go to a doctor she wanted to go with, not including in her little Medicare medical group bubble, and we found her company that she was with went up on Tier 1 medications by 20% that year, and it was the only benefit they went on, and I was able to get her guaranteed issue into a Medigap plan, or if they eliminate a benefit. That was a good one. Now, when I say they're different, apples to apples, a Plan F with one company is just like a Plan F with another company. That's why you need somebody that's going to review this every year. You get to hear us sing happy birthday to you, and then we look at your Medigap plan, okay? So you know the 4 options, A, B, C, D. Now we're going to go, the 4 parts. Now we're going to talk about the 3 options. What are they? Number 1, you can be on A and B alone. Pros and cons? Pros, you could go to any doctor, any hospital, any provider, any lab, imaging company that accepts Medicare. Negative, no Part D, no prescription drug coverage, and no maximum out-of-pocket. So that 20%, if you were going through chemotherapy, could get really, really costly. Option 2, A and B, plus that Medigap supplement and or a Part D plan. Pros and cons, go to any doctor, facility, provider you want to go to that accepts Medicare anywhere in the country. Negatives, you have 2 additional premiums in addition to your Part B premium. So that's the negative. And again, we work very hard to find you the most cost-effective method. And option 3, we said we're going to talk a little bit more about this, and this is Medicare Advantage plans. They combine your A and B. They have usually D. Most of them have D in there, and they give you extra benefits. Now, there's a bunch of different ones around the country. If we have people around the country listening, there's HMO, PPO, PFFS, MSAs, POSs. There's a bunch of different ones. If you're in the LA area, pretty much almost around California, there's really only HMOs and PPOs. So what do? They're issued by private insurance companies, but they're all different, and we have to make sure that your doctors, whatever doctors group that you choose, are in the plan. You have to make sure that. With the HMOs, you will have to get a referral unless the medical group has a self-referral which we do have one in Torrance, by the way, that is a self-referral medical group. Just know that if you're in an HMO, I love the way Melinda explains this. You're in your your medical group bubble. You have to get your care from that bubble. If you go outside, you're going to pay more. You're going to pay full price unless they authorize it. But they do give you a bunch of extra benefits. Dental sometimes, vision, hearing, chiropractor, acupuncture, and that wonderful gym membership that everybody always loves, but that I wish I had right now. That's no charge. And so with what you need to know about these Medicare Plan Cs when you're looking for them is a rating. Medicare rates all of their plans. They're 1 through 5. We have in California 1 5-star. The rest are 4.5 and below. So they measure them on a barrage of different activities. So you want to check out those plan ratings and then know if your doctor is going to be in there and how many medical groups are in that plan. Because if your doctor drops the medical group, guess what? It does not prompt a special circumstance to change plans. You have to change doctors at that point. So again, we want to know that there are a lot of medical groups just in case your doctor drops one. And what are their additional benefits? You know, I've got clients that love their little over-the-counter benefits where they can go get toothbrushes and toothpaste and antibiotic ointment. They love that. And Band-Aids. We hear they're the best Band-Aids around. How are your prescription drug covered? All of these plans have a different formulary, just like the Part D does. So we need to make sure that your meds are on their formulary. Look at the summary of benefits. If you go to any of what we call PI meetings during open enrollment, they'll all have it. If you sign up for a Plan C at the PI meeting, guess what? You have unlimited times you can change until the last one on December 7th. Whatever goes in, whichever one was the last one, is the one you're going to have next year. So again, we help you search through all of those. And then if you travel internationally, a lot of them do cover international travel too. So everybody, Diane, is going to be getting this booklet called an annual notice of change. Now, most people look at it, it's about yay thick, and they just toss it in the recycle bin. But guys, hold on to that book. Check out the first 10 or so pages. That's going to tell you what's changing in your plan. That does not mean it's still the right plan for you. It still needs to be reviewed, but will tell you what's going to be different, even the medication. So you definitely want to do that. Don't just ignore that. So, in summary, what to do? Well, you could do this yourself. I mean, a lot of people do. We have a little saying that friends don't let friends do this by themselves. Because when you work with somebody like us, like Hoffman Insurance Resources, you have us for no extra charge. Literally, we accept what the insurance companies pay us, and that's it. You don't have to pay extra for our time. And even if you're on the right plan, we're going to let you know, and a lot of people don't. I got to tell you, I've worked with a lot of agents over the years. A lot of them claim they're independent, but they only represent 1 or 2 companies. So at our company, we're licensed and certified, Medicare certified with everybody that we can be, as long as the rating of the insurance company is A and above. So you can do it yourself. You can look for a trusted professional. I would recommend an independent insurance agent that's contracted with a lot of different companies and certified in Medicare. We've come across a lot of like property and casualty agents or like financial planners and CPAs that they go out and get one company certified, and that's all they do is they put all their clients in that one company, and it really is not fair. Go to somebody that this is what they do. And go to somebody that can help you after we place the plan like we do. We completely can come to your place if you're close by. We're like the old-fashioned doctor with the black bag. We come to your location, or we can meet you out. Again, make sure that it's non-biased opinions that you're receiving, that it's no extra charge for your consultation. And for us, we have an ongoing staff that helps our clients, Diane, with other things. Instead of them having to sit on the phone with the insurance company, they call us first. And if we can do it for them, we do. And if we can't, we guide them on what to do and what's the easiest ways to maneuver whatever the issue is. And you always hear from, we just sent our letters out for Medicare just the other day. So all of our clients will be getting their letters saying, it's coming. Give us a ring if anything's changed. Otherwise, we're checking your plan for next year. We review that for our clients. And so in summary, we just know that you've got somebody that you can call, that somebody has your back. There's not many, I would say there's a lot of people out there, there's a lot of independent agents, but we work with your financial planning team. We work with your CPA also. So I would love it if there's somebody else that has any questions. I know there's a lot that we covered, and there's a lot more that we could cover, but if there's any questions, I'd love to take some.
Yeah, we'll take a minute or two because it is 1:30, so if there are any questions, pop in real quick. However, let me ask you, Debbie, real quickly, if there's one thing for folks to remember after this, in addition to the 3 and 4, what should those things be?
I would say don't do it by yourself. I really would. We've had a lot of people that try, and we get them later on when they've got a penalty, and the one statement that we hear is, I wish I would have known. You know, they wouldn't have done things differently. I think that's probably the best
Good to know.
It really is.
And
it doesn't cost anybody anything extra.
And do you help people outside of California?
We do. We're contracted and licensed in about 12 states now, because when our clients move, they don't want to lose us. So we go, okay, we're coming with you. And we get licensed in those other states also. And we do, by the way, for our under 65 clients, we also handle individual insurance, including certified with Covered California and employer group plans. But I will say, if you're outside of California, we really defer to somebody, an agent in that state, because that can get really, really muddy depending on the state.
So we have some additional questions, and what I want to do, because some people are asking some very specific questions, so you obviously have prompted some thoughts and ideas. So I just want to say to everyone, you've obviously signed up. We're going to send this information out. For those of you that are just on the call and don't have the video, the name of the company is Hoffman Insurance Resources, and their website is www.go2hir. go2hir.com. But we're going to send this replay out. Debbie and her team will be more than happy to help everyone. And again, there is no charge, because if you need something from them, from insurance or what have you, the insurance company will pay. However, the most important thing is, and that's the case with all of the folks we work with, she's more than happy to be her team to be consultants and answer those questions for you. So in the meantime, if like I said, we'll get this replay out to everyone with the video and the audio, so you'll be able to look at it, and Debbie and her team's information is on here. The specific questions, we have a number of them are coming in, and our time is up. So I want to thank you, Debbie. I really appreciate it. You've been great, and thank your team for helping all the folks that you have helped that we've referred you to. We really, really appreciate it.
Thank you guys so much. We appreciate what you guys do. It's a team.
It's a team.
Thanks,
everyone. Happy early weekend.
You too.